Hi everybody. Wanted to provide you with an update on our pizza and pop with Pierre. There was about 200 people there today, but that leaves a lot of you not able to come and enjoy a piece of pizza and a drink and hear an update on important things that are happening in the hospital. So providing this little video clip with some highlights from the session today. My slide deck will be part of the email, so you can click on that and look through the slides. But essentially what we were talking about today was kind of a recap of last year, 2017-18, and our drivers and all of the work that you've been putting into those and the change and improvement processes that have happened. And looking ahead to 2018, the year that we're in now, 2018-19, remember, we go by fiscal years, so the year starts April 1 and runs to March 31st of the following year. So we're about 25 days into the 2018-19 year, and we're looking back on the year that just ended March 31st. So as you know, there's we identified 4 drivers at the beginning of last year, and been a lot of work that's been accomplished on those drivers, and I'll just highlight some of them for you. But before I do, I'll just remind you that the work that we're doing together based on lean principles is firmly entrenched in the organization. We're committed to continuing, and that's work that's challenging. What we do when we identify drivers is to not find easy things to get a check in a box, but to find big goals that we need to aspire towards. Often those are difficult. Sometimes they take many years to chip away at, to test change ideas. But when we do make change and improvement, we need to solidify those gains and build from there. So in 2017-18, we really focused on the patient and family experience. There were 8 departments that were involved in change ideas. Some of the departments, you might have been part of this work, established comment cards in various ways to get the voice of the patient, and some of the challenges and opportunities that they identified, and worked on those. So for instance, in our acute mental health program, there was a suggestion that came forward from patients and families that there wasn't a private space to have conversations with family members or to make a private phone call. So staff responded to that need, and over the course of the past year developed a room that could be used for that purpose, and it's being used now to great effect. So listening to the voice of the patient is really important. On medicine, there's been Bedside Rounding that's been trialed and now firmly put in place. Another example is diagnostic imaging in the emergency department collaborated to provide a better experience for patients who are coming into the emergency department late at night, requiring diagnostic imaging that wasn't available until morning. And in the past, all of those patients would wait through the night until their test could be completed. And the good folks in DI and the emergency department found a way to schedule appointments, enable those patients to go home, sleep in their own bed when that was appropriate, and come back to a booked appointment for their diagnostics first thing in the morning. So a better patient experience and a good use of people's time. So those were some of the initiatives that were mounted last year. 10 change ideas, 8 departments were involved, and we're really looking at patients and families as being partners in care. We're going to continue with patient and family-centered care is what we're going to call it this year, and broaden that out in 2018-19. The other thing that we looked at last year was the appropriate use of antibiotics. A lot of work was done, some of it around education, identifying best practices, improved review processes for antibiotic use, and some clinical pathways. Still lots more to be done in antibiotic stewardship, and that will continue into 18-19. The other driver was on reducing unnecessary admission, or readmissions rather. So a 30-day readmission rate on CHF, chronic obstructive pulmonary disease, COPD, I forgot the acronym there, mental health and addiction conditions, and heart failure. So those three areas were targeted for readmission rates, and a lot was accomplished such that we're moving that off of being a driver, and it'll be a watch metric next year. In terms of the new driver around patient and patient experience, we're going to broaden that out and look at culture of safety in the coming year. Both safety for our patients, but also for our employees and physicians. 4 departments and 2 committees have identified change ideas that are going to be part of our quality improvement plan. The fourth driver that we were looking at last year was staff engagement, and 724 change ideas were brought forward to huddles last year. We also committed to having our senior leadership team, our directors, attend more huddles and get out and do more Gemba walks. Really great engagement scores. This past survey benchmarked against our survey of about 14 months ago. So our target was a 10% improvement in engagement scores, and we exceeded that. So that work seems to be effective. We're going to continue with engagement in the coming year. What we'll be targeting are the 3 lowest scoring questions in the engagement survey, and looking for a 10% improvement in those in 2018-19. We're also challenging ourselves to get 750 improvement ideas. There's about 750 staff in the hospital. If every person came up with one idea for change and improvement, we'd meet that goal. So challenging all of you to think about what could be done better in your area of work. For 2018-19, so the year that just started, we've got a new driver in terms of stewardship of our resources, financial stewardship, and we're looking to improve our cost per patient day or visit. So looking at efficiencies, how to do the same or more with fewer resources. So driving out waste, which is paramount in our lean work, and doing more for patients with the resources that we have. So our True North metrics for 2018-19 in terms of quality and safety, we're looking at culture of safety in a broad way. Financial stewardship, we're looking at improving our cost per patient day or visit. In terms of working together, we're looking at staff engagement again this year. And for patient and family-centered care, we're looking at making sure that patients and their families are receiving the appropriate care, and we're identifying their needs and responding to their needs. So that's kind of a broad overview. At your huddles, you'll hear more. There's kind of a 2-pager on each of our drivers from last year that'll be shared with you. And please click on the link to the slides that were delivered today, and you'll see some of the graphs and some of the improvement areas. So thanks for taking the time to watch this. Until next time, all the best.